My name is Becky Connor, and I'm a nurse practitioner. I work with the Health East Critical Care team. I have been here at Health East for 6 years now, and before that I worked as a nurse clinician with neurosurgery at another hospital for 14 years. My background had been neurosurgery and more specifically neurotrauma. When I went back to school and finished my nurse practitioner certification and education, I was recruited to Health East Stroke Unit and came here straight out of school. I came to neuro out of the trauma ICU in this hospital, and I found neurotrauma to be the most emotional, whether you were the most involved, the most fascinating, and the most lifelong effects that you could make a difference in for those families and for those patients, of all the different kinds of trauma patients. I think that what's most satisfying is feeling like when I come here, I actually have some input into the plan of care for the day, for assisting, creating a plan that day and making sure that seeing how it follows through and how it plays through, and being able to see the results of that plan by each day, being able to come back and follow closely. What I like about inpatient nurse practitioner is that you can see the plan that you make and you can see the results very quickly. It's not like outpatient nurse practitioners who have to have a delayed gratification for seeing how their plan works. I get to see my interaction every day. I think that you really see a dedication here from nursing administration and nursing management to have developed a very clear and very specific program around patient rounding and going in to see each patient and family each day, more than once a day, to make sure that they are getting what they need. If they have any problems, they're immediately addressed at that point in time. They're not waiting to hear how the patient did after they've left the hospital. They're actively involved in trying to make their care good at that point of care. There also is a very coordinated care management team that works here in the ICU and in the step-down units for meeting the family immediately and being able to work almost from day one from what the plan is, what to expect, and to help them move along through the hospital. I think key to the personality is probably a little bit of OCD in following up on what the plan of care is, and that it's everybody in the nursing staff and the intensive care unit understands what the plan of care is and how they can achieve it and how we're trying to get there. There's also a lot of attention to detail in an ICU that you really need to keep together so that things can move along, and things don't follow through. And that's actually very unique to the nurse practitioner role in the critical care, because they're uniquely situated to follow all those details to make sure things don't fall through the cracks. We're just growing the role right here, so there will be a lot of impact into how it's scheduled, how you interact, how it's going to develop for our independence and our how the program develops around us. And also I think that the nursing staff, like we talked about, are really hungry to grow and improve. So coming in with the idea that you want to do some education, that you want to bring this group up to a better critical care level, you have all that opportunity to do here.